Our physicians will do many different types of in-office procedures at Foot and Ankle Surgical Associates. It will be your duty as the back office assistant to prepare the patient and supplies necessary for each procedure. This tutorial will walk you through the more common procedures that are performed in the office. You will be instructed in each aspect of assisting, from prepping the patient to preparing the instruments, sterile tray, and bandaging. There are certain situations that will call for special instruments or a specific type of bandage. You will be instructed by your physician if these instances arise. There are 4 common types of procedures that occur in the office. They are nail procedures, wart treatments and excisions, hammer toe repairs, and soft tissue procedures. Within the office, there are 2 types of nail procedures that are common: the permanent and temporary nail removal. The permanent nail removal is also called a matrixectomy. The matrix is commonly referred to as the nail bed and is where the nail grows. By destroying the matrix using a chemical named phenol, nail cannot grow. This is the purpose of a matrixectomy. It's common to use it to treat ingrown nail borders or thick, painful nails that will not grow correctly. Patients find that living without a nail is much more pain-free than living with an ingrown nail. This procedure can be total, which would be the full nail, or partial, which would only be the problematic nail piece. An avulsion is exactly the same procedure as a matrixectomy, except the chemical phenol is not used to kill the matrix, and the nail may regrow. You will need to gain consent from the patient prior to being anesthetized, if possible. The yellow consent form is located in the form holders on the wall. You will need to fill in the name of the patient, date, and doctor name. The procedure is either permanent or temporary removal of nail. You need to make sure to put the correct part of the nail, either the full nail or a specific border. The reason for removal will be painful, infected, and ingrown nail. Do not abbreviate anything on the consent form. Directions such as left and right must be written out, and you should write the type of procedure as plainly as possible. This is supposed to be understood by the patient. You do not need to write very difficult technical terminology. Make a note of any allergies the patient may have and explain to them the purpose of the consent. You should get into the habit of saying the same thing each time, so read the consent and make sure you know what you're asking of them. If the patient is clear to this point, have them initial the bottom corner and turn it over. You will see a list of other possible treatments. The problem is the nail, so it must be removed. The next list is a list of complications to watch for. Our main concern is that of infection. To ensure no infection occurs, they must follow the post-operative instructions that will be given them after the procedure. There is a place to list additional risks. If you're doing a matrixectomy, you will need to make sure that they know there is a 5% chance of regrowth and have them initial by the line. If it's an avulsion, this section may remain blank. Make sure they understand each item you outline, and if so, have them sign the consent form. You will need to sign as their witness and date the consent. The patient is now ready to be prepped. You will need to prep the area with iodine. To do this, make sure you put on gloves and grab a 3-swab iodine pack and open it. To prep the area, begin with the area we'll work on and slowly make a circular motion around and away from the area with the iodine. You should never go over the same area twice so as not to cross-contaminate. Because the toenail is considered a dirty area and we are not actually cutting into the skin with an incision, this nail procedure is considered a clean procedure, as opposed to a sterile procedure. This means you must use sterile instruments, but sterile gloving and prepping is not required. We prep for peace of mind and extra precaution. After the patient is prepped, you will need to prepare the instruments for the physician. To set up the instrument tray, you will need a Mayo stand, nail pack, and non-fenestrated sterile drape. Remember, though this is considered a clean procedure, we take as much precaution to ensure the field and instruments remain sterile until they come in contact with the patient. Open the non-fenestrated sterile drape and be careful to hold it on the sides outside of the crease. Unfold the drape and place it on the Mayo stand. You will then open the nail pack and drop the instruments on the field without touching them. You are now ready to take the instruments to the room for the physician to perform the procedure. When you place the instruments in the room, you will need to prep the field further. You will need to place some 4x4 gauze sponges on the tray, as well as some Amerigel or Silvadene. If you're doing a matrixectomy, you will need to place 3 small cotton Q-tips for each border of the nail you're killing. If you're doing 2 borders or the whole nail, you'll place 6 for each toenail being removed. If you're doing 1 border, you only need 3. You will need to tear off a Coban bandage for each toe. Alcohol neutralizes the phenol, so if the procedure is a matrixectomy, you will need to place the phenol and the alcohol on the counter. Make sure the physician has eye protection at all times during the procedure, so lay out glasses. If you are doing an avulsion only, you will not need to put the phenol or the alcohol out. Place only 4x4s and Coban on the field. When the nail procedure is complete, the physician will turn the patient over to you as the back office assistant to clean up and bandage the patient. To bandage the nail procedure, you will begin by making sure the blood flow is contained by using a 4x4 and applying firm pressure. If the procedure was a matrixectomy, you will apply a generous amount of Marigel to the wound site. If it was an avulsion, you will apply Silvadene to the wound site. Amerigel is a special wound gel that is targeted specifically to help heal burns. The phenol used in the procedure causes a chemical burn to the area. After application of the Amerigel or Silvadene, you will then place a folded 4x4 on the wound site. You will finish the bandage off with a firm Coban wrap and stockinette. You will need to instruct the patient how to take care of their surgical site at home. To do this, give them a permanent nail removal handout found in the second drawer of each room. This handout is good for an avulsion as well. You'll need to explain each point listed on the sheet. Remove the dressing that night, preferably before the toe is no longer numb. Soak the area in warm water for 10 minutes twice daily. They do not need Epsom salt or soap. When soaking, be sure to give gentle massage to the area. If it's a matrixectomy, this will prevent a scab from forming. When the phenol kills the nail bed, so that the dead nail cells can't grow, those cells are going to start draining from the area. As they do so, their tendency will be to form a scab. If a scab occurs, it will dam the cells inside, keeping them from being able to drain out, and can cause infection. So instruct the patient to give gentle massage to the area. And cover the area with a loose band-aid and apply a small amount of their antiseptic gel to the area, whether it be Amerigel or Silvadene. Instruct the patient that redness around the area is normal, but if the redness increases or begins to streak up the foot, and they feel signs of infection such as fever, chills, nausea, or vomiting, they need to call the office immediately to be seen. For patients with warts, there are two main treatments that we use in the office. The first treatment usually consists of a sharp debridement with a 15 blade, and application of cantharidin, a chemical that creates a blister under the wart, removing it layer by layer. It is the first line of defense against the verruca. When this is not enough, however, or the wart is large enough, excision is indicated. To set up for cantharidin treatment, you will open a foot care pack and place a 15 blade, 4x4s, the cantharidin, and a Q-tip for application, plastic tape, and spray adhesive on it. This treatment is not necessarily a procedure that needs a sterile field, but it is common and requires you to prepare the room for the physician. In the case that a wart excision is required, you will need to prepare a sterile tray. This procedure is set up similar to the nail procedure, except it is considered a sterile procedure. To set this procedure up, you will need a sterile, non-fenestrated drape, a large curette, sterile 4x4s, and a sterile 15 blade. Phenol will be used at the end of the procedure to cauterize the tissue, so place the phenol on the counter. Again, take care to open the drape in a sterile fashion. The outer edge of the drape is designed to be the area you can touch when opening it. Lay the drape out flat and open the instruments on the field. Be sure to keep your body 12 inches from the field. When the field has been set up and the instruments and supplies have been dropped on it, you will need to set out a pair of sterile surgical gloves for the physician, and you're ready to send the doctor in the room. When the procedure is finished, you will need to be available with the phenol and Q-tip for the physician. The physician will bandage the patient, which will consist of Silvadene, 4x4s, Cling, and Coban. Instruct the patient to remove the bandage in 6 hours and do warm water soaks once a day until seen in the office. Make sure you go over all the information regarding infection. If they experience any streaking redness, fever, chills, nausea, or vomiting, they are to be seen immediately. Hammer toes are common concerns patients see us in the office for. This usually occurs when the flexor tendon in the toe becomes contracted or shortened, causing the toe to be stuck in a bent or curled position. It can be very tender to walk on due to the pressure from the ground or shoe. This is a common problem in patients who have ulcerations on their toes from lack of feeling and extended friction. Commonly, these concerns can be handled in the office by a procedure called the flexor tenotomy. The physician, using a 15 blade, will actually cut the flexor tendon such that it is able to lengthen, allowing the toe to sit more flat. The instruments you will need to prepare for the physician are a sterile, non-fenestrated drape, sterile 4x4s, a sterile 15 blade, which can be found in the nurse's station in the top drawer, sterile steri-strips for closure, and Coban for bandaging. Be careful to remain sterile. Open the drape as previously shown, only touching the edges. Place all the instruments and supplies on the field. You will need to be prepared in case the physician needs a suture to close the wound. This will call for a nylon 4.0 suture, a needle driver, and a suture removal kit. These items should not be opened on the field but on standby to be used upon doctor's orders. The bandaging will be done by the physician. The patient will be instructed to keep the bandage on for 4 to 6 days, giving the puncture wound as a chance to heal. They may then remove the bandage and apply a simple band-aid. Explain again the risk of infection and that they should call if they experience any fever, chills, nausea, or vomiting, as well as streaking redness. They should not get their foot wet until they remove the bandage 4 to 6 days later. There are multiple different soft tissue procedures that could be done in the office, anything from an incision and draining, or I&D, of an infected wound to a biopsy. To set up for these procedures, the main instruments and supplies you will need are a sterile non-fenestrated drape, a sterile 15 blade, sterile 4x4s, and depending on the procedure, you may need other supplies. For an I&D, you will more than likely need a drain or packaging for the wound. Biopsies will require a biopsy punch for the correct diameter, as well as sutures, suture removal kit, and a needle driver. Bandaging will be done as directed by the physician, and special instructions will be given by the physician. Again, make sure they understand the risk of infection and to watch for any fever, chills, nausea, or vomiting. For each of the procedures in this office, we will have the patient follow up as normally scheduled.